So my name is Catherine Swan. I'm delighted to formally welcome you all to the webinar today. I am proud to introduce you to our speakers this morning. We have the founding partners of Well Minds at Work, Lauren de Ventura and Dr. Amy McCarthy. And we are also joined by Morgan McKinley's People Director, Andrea Webb, for this informative webinar. So Andrea, over to you.
Thank you, Catherine. Good afternoon, everyone. It's great to be here hosting this important webinar with Well Minds at Work. Most organisations, experts, mental health charities have warned for some time now of a mental health emergency. As we know, the pandemic has placed a huge burden on people. Many people have been feeling anxious about their health, anxious about the health of their loved ones. Many people have lost their jobs. Millions have been on furlough. And for those that are working, many have had to endure doing that over prolonged periods from home, and potentially having to do that combined with childcare responsibilities or homeschooling and the like. And so with all of these additional burdens, job security, financial security, family and health worries, with many people experiencing feelings of isolation during this time, it's no surprise, of course, that mental health problems are on the rise. And there's plenty of evidence now to support that being the case. An example I came across recently was a quite startling statistic that the levels of depression amongst adults have doubled during lockdown. So that would be almost 1 in 5 adults experiencing some form of depression during the pandemic. And for me, that really sort of hit home the severity of things, particularly right now. Finally, I think it's important to recognise that mental health challenges can happen to us all, that anyone can struggle. I would say that from my own professional experience within HR, we've seen a noticeable increase in people presenting themselves with mental health challenges within the workplace. But what I would say about that was certainly a trend that was happening really quite some time before the pandemic, but obviously the pandemic has supercharged that in many ways for lots of people. And so today's session, we'll be looking at what we can do to help one another in the workplace from a mental health perspective, but also importantly, what we can do to help ourselves. So I'd like to hand over at this stage to the experts at Well Minds at Work. Lauren, Amy, hi. It would be great if you could share with us a little bit about what you do at Well Minds at Work before we hear your valuable insights and advice on this important topic.
Thanks, Andrea. And firstly, thanks for inviting us today to partner with you on such an important topic. Before we get into it, it would be great, I think, for us to introduce ourselves. So prior to founding Well Minds at Work with Amy, I worked in corporate HR for around 18 years. And I guess I'd experienced and seen firsthand just how poor mental health can have such a detrimental impact in the business. I'd seen individuals struggling with their own workloads and the stresses that caused. I'd seen managers really struggling to have conversations with their team members and having the confidence to be able to have those conversations as well as skills. And then I'd also seen leaderships and boards really struggle with how to tackle the issues and invest appropriately. So that's really what drove me to co-found Well Minds at Work with Amy. And we're on a mission to help as many companies as we can to destigmatise mental health in the workplace and to ultimately value a more diverse workforce, because the more that you can attract a more diverse workforce and open up different talent pools, the wonderful world, it becomes to, for different organisations to have, have that diversity at work. And we do this through a number of different ways. So we work with different organisations in different sectors. We provide consulting services, which I'm going to talk about shortly, where we come in and we look at what strategies you have in place. And then we help you to put and define and embed a mental health strategy. And we offer different training programs, again, which I'll talk about shortly, but really focusing on mental health awareness, mental health managers. We do mental health coaching, and we do that a lot with leaders. So really looking at how they shape their own stories and communicate that in the business. And we also have a psychological referral service. So what's quite unique about us is that we bring together a real unique blend of both clinical and commercial expertise. So how do you commercialize it in the business? How do you make sure that it's got the return on investment if you're going to invest? But also, how do we bring the sort of the most latest research into the room to make sure that it's effective? Amy, would you like to introduce yourself?
Yeah, thanks, Lauren. So hi, I'm Amy. I am one of the co-founders of Well Minds at Work. Great to be here today and see so many of you on the call. So not only being a co-founder at Well Minds at Work, I'm also a practicing psychologist. So I see lots of people for lots of different reasons. And throughout my career, I've worked in a range of different organisations across different sectors. So in banking, in finance, legal, insurance, providing psychological services. And I do a lot of work at the moment with Google. And I reference Google because they really are at the top end of wellness at work. They take it really, really seriously. And I appreciate that not many organizations have Google budgets, but one of the things that they do that I think puts them on the map is that they really do invest their time, they invest money, and they take it really, really seriously. And it's been really interesting working with them and seeing a lot of the initiatives that they put in place and how that works. And I suppose before I was a psychologist, like a lot of you, I worked in HR. And I think a lot of what Andrea said and Lauren had said, I experienced a lot of managers and employees who were really struggling with their well-being and really struggling to know how to manage it, how to have the conversations. And you'd often see a lot of people where situations just got really tricky and got really difficult and quite unnecessarily sometimes. So I think having that experience of working in HR combined with the psychological work that I do, I think puts me in a really unique position to be able to offer skills and support to businesses like yours to tackle this really important issue around around mental health.
Thanks, Amy. So let's get into it in terms of the topic today. So the mental health pandemic. So why is it being referred to as a pandemic? Well, the numbers speak for themselves. And the scary thing about this is that these numbers were pre-COVID. So we know that as of 2019, poor mental health was costing the UK economy circa 45 billion. We know that many people feel uncomfortable and felt uncomfortable talking to their manager about their mental health and didn't know how to approach that conversation, and that many have been affected because of poor mental health in the workplace specifically. But what's interesting about this slide and what a lot of people tend to get drawn to when we talk about and we show these statistics is presenteeism. So for those of you that don't necessarily know what presenteeism is defined as being at work unnecessarily. So being at work when you don't need to be, and it's generally a symptom of job insecurity, but also it could be you're there if you're sick and you should be off, taking the time to recover, and that's a very stark figure. So 29 billion it costs in terms of presenteeism. The other stat there as well that I think is interesting is the experiencing stigma. So we know that there is an issue in society around mental health and a real stigma towards mental health. But 90% of individuals who have suffered with poor mental health have also experienced stigma in the workplace. And this is a really interesting number because ultimately we all have mental health, and that's something that Amy's going to talk about shortly. But when we go into organisations, one of the top 3 things typically that they want to challenge is stigma in the workplace. How do we overcome this? How do we make it okay for people to talk about it whilst remaining, commercial, whilst remaining productive? And it's a real balancing act, and it's how do we do that? And again, that's something we're going to talk a bit about today. And just coming back to the presenteeism, what we see in organisations is that those that have a really poor approach to mental health and well-being, employees will typically feel like they can't have that conversation, they can't talk about their workload, and what happens when you do that is you drive a much more collaborative approach to finding a problem to solve it. And that obviously leads in turn to a much more positive work environment. So some really interesting statistics there.
So what do we mean by mental health? Well, it includes our emotional well-being, it includes psychological, cognitive functioning, our social functioning. It impacts on how we think, how we feel, and how we behave. And as Lauren said, we all have mental health. I think we need to start moving away from the idea that mental health is, sometimes when we think about that term, it conjures up ideas of there being something wrong with us, that there's a diagnosis, that we're broken in some way. And that's not true. We all struggle with difficulties throughout our lives. We're all on a continuum, and we'll move throughout this continuum throughout our lives, throughout the day sometimes. So it's really important to understand that this is a normal human experience. That saying it's okay to not be okay, it really is okay to not be okay, because it means you're a human being and you're struggling with the things that all of us struggle with from time to time. We need to start thinking about mental health in a way that we do, I suppose, around physical health. We need to start taking care of it. We need to start talking about it more, because the more that we talk about it, the more we start to destigmatize, the less we're seeing it in the other. Let's be clear, this is something that impacts all of us, and it's something that we all need to be thinking about in order to, manage it, in order to make things better.
So mental health is multifaceted. There's a number of things that impact our mental health, and obviously work is a key factor. And what we know from research, and what we know from the organisations that we work with, is there are 8 core factors that can positively impact somebody's mental health and mental health in the organisation, and these won't come maybe as a surprise to some. They are relatively intertwined with each other, but if we just look at some of them, good communication and management practice. I mean, ultimately, good communication sits at the heart of the business, but from that, people will feel valued and recognised. Having some level of decision making in their own workload, and having that level of control, can really have a huge impact on somebody's perspective and their mental health. Looking at things like what levels of support are in place for employees, and people feeling connected to what's going on in the business and what's going on in the organisation through understanding what's expected of them. So those 8 core factors will typically have, and create the best environment for good mental health. When we go into organisations, the first thing that we will do is we carry out a health assessment with the business. And what's really interesting is that through that process, we gather lots of different data. And that's probably the first thing, I think, in all of this that Amy and I would share with you, is in our experiences, many organisations that we work with do not gather the right data. So you think about all of your data points, all of the financial information that you gather, your people information, and there's lots of great information in your businesses, I'm sure. But really looking at gathering the right types of data ultimately will help inform where you invest, and your decision making around what issues you need to address. So an example of some of the things that we've seen in terms of that data would be looking at carrying out, short surveys around employee engagement. How are people feeling? How are they feeling about their workload? Do they feel they have good work-life balance? Obviously something at the minute that people are feeling quite challenged around, but really looking at that temperature check in the business. Looking at other types of data as well. So one of the things that we would look at in terms of the HR data available is and one thing that's a good key metric is obviously sickness, but are you looking at things like annual leave? How frequently are people taking their annual leave? Do people frequently carry holiday over? These sorts of things are good signs around whether people are taking their leave appropriately, whether people are getting rest, and they're all things that contribute to somebody's good mental health. In terms of support for employees, this, looking at all of these intertwined different factors, there is not a one initiative that is going to address all of these aspects. It is a much more holistic approach, and in your organizations you will have different communities, and understanding what those different groups are and putting in place the right support for those groups is critical. And an example of that at the minute is we know that COVID is having a huge impact on 21 to 27-year-olds because of the reduced amount of social interaction that they're able to have. We also know that it's having an impact on our BAME colleagues because they are more susceptible to getting the virus. So looking at those groups, for example, and understanding what have you got in place? Have you got enough there to support them? Do you need to do something different? But so it's really looking at the data and then making, grounding that data to help you make decisions. And then in terms of, at the centre of it, if you think about leadership and culture, culture is the foundation of any business. And, it's like the analogy, isn't it, of building a house. If you don't have good foundations in place, the house can be amazing, but you're going to start to see issues after a while. And it's the same thing with culture. Having a good, open, non-judgmental culture in place is really important to supporting good mental health. And the final bit on this, I think, in terms of the slide is leadership. We typically talk about mental health. It can be seen as quite fluffy. And something that sits with HR, they can own it, it's fine, or a similar department in your businesses. And it has can be part of that, I suppose, tea and tissues kind of approach historically, but it's not enough, and we have to start taking it seriously. And one of the ways that we can do that, and where it really starts, is with leadership really owning it and owning it from that top down. And we do different mental health coaching with boards, where we really help them to to frame their story and to look at how can you best communicate that to the business so that it really sets the tone for your employees to also be able to share their stories. So what's our advice for businesses, first of all? Well, the first thing is if you have got a mental health strategy in place, fantastic. If you haven't, obviously start to think about what that might be. And our advice is to, we would say, get somebody external in who has got the right expertise and can give you that perspective on what you're doing. Gather the right data. We can't stress this enough. You will have access to different types of data in your business. So it's really looking at those core factors and looking at what you currently gather, and then going out and making sure you're asking those questions to employees around their experience, but also you're looking at your HR data and making sure that it is it is giving you the right information about mental health in your business. making sure that your wellbeing initiatives are grounded in data. In my experience of working in HR for nearly 18 years, I've seen lots of fantastic initiatives be put in place, and I still hear about them today when we go into different businesses, and they can have a real positive impact. You know, yoga classes, gym memberships, you know, all of those sorts of things can have a fantastic positive on people's wellbeing, but you know, it might not be long-lasting change to really addressing some of the issues in your business. An example, I think, as well of grounding it in the data is, Amy and I recently worked with a professional services business, and what they found was they were losing people at that 3 to 4 year mark, and they had a real work hard, play hard culture, which was fantastic when you joined. You know, really, they're really fun. But what we were finding was, we went in and looked at the data, was that they were suffering from burnout. So a few changes made in terms of, you know, really drawing back, how can they really make it more inclusive? How can they make some adjustments to some of that workload? How can they refocus some of that? And they're already starting to see some real positive change in that 3 to 4 year group. We talk about culture being at the heart of it, and it really is. And I think in terms of you know, advice for you, if you are you know, if you do have a real sort of, you know, buck up culture and kind of get on with it, it's about being realistic about what changes you can make, and the steps you can make to, you know, to achieving that. And one of the things that can be really beneficial is starting with some mental health awareness training, really increasing the awareness of it in your business, and driving that good citizenship in the business, and making sure that everybody knows that they're part of it. It's not an exclusive membership. And then I think finally with this, it is about identifying mental health champions who can drive it. You know, it is that good old saying of, you know, with a change program, for example, you've got to have people behind it. It's got to be clear. It's got to be linked to the strategy. But ultimately, if it's not being driven, you know, it won't have that impact. So absolutely making sure that people are identified in the business who can really drive it.
Thanks, Erin. So we've talked quite a lot about mental health in the workplace and how work impacts, but, you know, it's really important to think about other areas that impact our mental health. You know, we are complicated as human beings, and there's lots of factors that impact on how we feel. One of the key ones that I see a lot is, I suppose, relationships. And, you know, no matter what time of life you're at, you know, if you're in your early 20s, then colleagues and friends are a priority. Getting into your 30s and 40s, children, family, older parents can be a priority, and how those relationships, you know, develop have a huge impact on how we can feel. And sometimes, you know, they can become quite all-consuming. You know, if anybody's ever experienced you know, a major life event like divorce or a relationship breakdown, you know, that can just take up everything, and, you know, work can kind of slip into the background a bit. You know, physical health is intrinsically linked to our mental health. You know, whether you've got a long-term physical health condition, or, you know, you've just been a bit under the weather for a few days, it impacts on how we feel and how we behave. We know that people with who might have experienced difficult personal histories, if they've had difficult childhoods, I mean, I'm a psychologist, I would be saying this, but we know that impacts on our mental health. So I think it's just important to, you know, if you're a manager or anybody really thinking about how you might talk to someone else about their mental health and their well-being, you know, I like the idea of the iceberg model. You know, you have the tip of the iceberg, and that's actually all we see of people, and the bit that's underneath we don't know about, and we don't see it. And that's, you know, we might not ever know about somebody's personal history. It might not be, you know, relevant or appropriate to talk about it. But it's just having an awareness that there is a lot more going on underneath than what we're just seeing on the top. So it's just important to bear that in mind. I think one of the things when we're thinking about our self-care, one of the things, or an easy thing I like to think about, is what I call the ABCs of self-care. So thinking about awareness, A for awareness, you know, think about what are your needs? What are your emotional triggers? What things make you feel stressed? And be aware of them in your life. And if they feel like they're seeping in, then, you know, do something about it. B for balance. you know, it's really important at the moment. We have got, we're spending more and more time at work. The world outside of work is shrinking. So, you know, we have to work a bit harder at the moment to find more fun things to do, to put boundaries back in place, you know, for work, and you know, get creative, do something that's gonna give you a bit more, you know, of a fuller life outside of the working world. Connection, C for connection. Again, this for me, I think, is the most fundamental part of our well-being, feeling connected to each other. You know, again, coming back to our relationships, you know, we're all primed for connection. We all want to be connected and to connect with others. It's hugely important. And, you know, again, in terms of how we feel, connect with ourselves a bit more, connect with the world outside of work, connect with something bigger, something more meaningful. So just some tips really for, I think, how you can look after yourself and how you can stay well at the moment. You know, it's really important to remember that we've been through, you know, what we've been going through in the last 9 months. It's been a trauma, collective trauma. So, you know, and all of us have lost something, you know, in the last 9 months, whether it's been, you know, we didn't get to go on the holiday that we were hoping to with our families, or we struggled in a relationship, or we didn't get to, there might have been an experience we were hoping that would happen, or sadly we've lost somebody down to COVID. We've all experienced loss somewhere along the line. This has not been the year that people expected it to be. So just being mindful of that, being respectful and a bit more compassionate to each other. And then just some advice for managers. As Lauren was saying earlier about leadership, there's nothing more powerful than a senior leader in their organization standing up and saying that they're struggling, that they've had some experiences that have been difficult. You know, this has a profound impact on the organization. It allows everyone else it creates psychological safety. So it allows everybody else to experience their difficulties and to start talking about it. It sets the tone. For managers, you know, one of the trainings that we provide at Well Minds at Work is about how do you have a conversation with somebody who's struggling with their mental health and well-being. And going back to what I was saying about connection, you know, we are all primed for it. You have actually already got the skills to be able to have these conversations. You just might not know it yet, but it's just things like being able to listen, being able to be empathic, be kind, and, you know, to just give you some confidence to have those conversations. You know, managers are kind of like the pulse point in the organization. They know what's going on the ground, and to be able to have, you know, meaningful and informative conversations with their staff or their employees is really, really important. Give managers a toolkit. You know, if you are struggling, we know that 1 in 4 of us will experience a mental health condition at some point in our lives, sadly. You know, if you are working with somebody who is really quite unwell, what do you do? You know, what's in place in the organization from like a duty of care perspective? How do you help that person? And then similarly up to, you know, somebody that might just be having, you know, a difficult day. It's not necessarily a mental health condition, but they're just struggling. You know, what's the process? What's there for you to be able to offer to help? Really put mental health on the agenda for every team meeting you have. One of the things I've started seeing in organizations is we're doing a lot of these kinds of calls. We're on Zoom or on whatever your platform might be to do these meetings. Spend 5 to 10 minutes just having a kind of well-being chat. How are you? How was your weekend? What have you been up to? How are you managing, you know, the kids at home? How are you dealing with boundaries? How do you make sure you switch off? Make it part of the agenda. And make it mandatory in all of your one-to-one conversations to put, as I said, mental health on that agenda. Another thing that we've done in an organisation I can think of, we put in, we think a lot about performance and productivity, and we've got plans around performance. And what we did in this organisation was put in place well-being plans. So you could actually see, well, where is it that you want to get to with your well-being? What areas are a bit weak at the moment? What can you strengthen? And put it in writing. And then you've got something to work towards. And the other thing about this is all very well us talking about it, but we do need to do things. We need to take action in terms of our well-being, and having that plan, it makes us all accountable. Because I think sometimes the danger is that this can all just fall to, or it feels like it can fall to managers to have to deal with this and to manage it. And, you know, we've all got to be accountable for our well-being. Lauren, if you don't mind going on to the next slide. Thank you. And then this is just about, you know, these are things that you've probably already seen. you know, they're not new tips, but I suppose they're just really important to remind you of how you can start looking after yourself. Thinking about the commute, you know, we all used to be able to commute. Some of us had a 2 to 3 hour commute into work. We found time for that. You know, just go for a half-hour walk at the beginning of your day. I hear a lot of people saying, oh, you know, I get kind of too caught up in work and then I can't take the break. Well, go at the beginning or go at the end, you know, reclaim that. One of the things I'm seeing a lot of through my private practice is issues with sleep. And, you know, going back to what I was saying about this being a collective trauma, if we experience trauma, you know, it impacts our bodies, it impacts our sleep. So, you know, just have a think about how, if you are struggling with sleep, just think about the basics and go back to your sleep hygiene. You know, are you drinking too much coffee? It's very easy if we're sat at a screen to try and keep motivated to just drink too much caffeine. You know, are we drinking too much alcohol? You know, a lot of us are, you know, finding we have a glass of wine at the end of the day to kind of, you know, try and step away from work, because that can impact on our sleep. Do something that's a bit more soothing. Turn the technology off earlier, because again, that, you know, keeps up that blue light filter. It keeps our brain too engaged, and we need to start to calm it down. And I put mindfulness on here. You know, it's a hot topic. A lot of people talk about the benefits of mindfulness. There is a lot of research to indicate that people who practice mindfulness regularly do struggle less with depression and anxiety. I think for me, the thing about mindfulness, and particularly at the moment, it's about being present. It's about just being in the moment. And what we can do when we are struggling, when we are in a difficult time, we can think a lot about the future. We find ourselves worrying about things that are going to happen or thinking about things that have happened. Mindfulness just gives us an opportunity to come out of our heads, get into our body, and just be a bit more present. And it can just make us feel a little bit calmer and a little bit more relaxed. It's not always as easy to do, but as I said, it can be quite helpful. One of the things I would just caveat all of this with, if you have tried a lot of these things and you are, you're not necessarily seeing any improvement, then do reach out, do try and speak to somebody professionally, or, you know, reach out to, there's some great resources, which I think we're going to do a blog after this and we'll put some of those in there. But, you know, Mind have got some fantastic things on their website. The Mental Health Foundation have got some really good things. Time to Change is another one. So just, you know, just bear those things in mind. It's interesting to note, I think something that Andrea said about the numbers of depression doubling in this period of the last 9 to 10 months. What the stats have shown is that I think 8 out of 10 of us have been displaying symptoms that can be related to a mental health condition. Now, I'm not saying 8 out of 10 of us have a mental health condition. We don't, but we are all struggling a lot more. So it's just really important that we just, if we can, work a bit harder at looking after ourselves. That's, I think, oh, sorry, my last top tip before I finish. If you do nothing else for you know, in regards to well-being, just start the conversation. Anybody who's listening, if you're a manager, an employee, an HR person, just start talking about it in the workplace, with friends, with, you know, people around you. Be honest, be authentic about your experience, and you might find it's really, it starts to change things. You might find it's healing, and it's useful for other people in terms of what you might hear back. So that's us, I think, done. I think we're gonna and also, I suppose, just to say, sorry, I will finish in a minute, I know I keep saying I will. We'd love to hear from you. So I think our details are on here. Please reach out to us. Please tell us about what's going on in your businesses. We'd love to hear from you. And yeah, thank you for listening to us today. I'm going to hand over to Catherine, I think, now.
Lovely. Thanks so much, Amy. We do have a little bit of time for a short Q&A now, but as you've alluded to already, we are going to produce some articles and blogs following on from this webinar, so we will address other questions in that for the audience as well. But perhaps if I could start just with you, Amy, what resources might be available within a workplace to help with mental health, in your opinion?
Yeah, it's a really good question, Catherine. Thank you. So I think it really depends, and it goes back to, I think, what Lauren was saying about the data. You know, we can have lots and lots of resources or initiatives in the workplace that aren't grounded in data, so they're not relevant necessarily to what's actually going on. So it is really important to have a look at your own organisation, because what might be working really well for one doesn't necessarily work really well for another. So that's really key. But I suppose if I had to pick one key thing, it would probably be mental health awareness training. You know, going back to what we said about culture, about how you can start to initiate change and start that conversation. If you can train everybody in your organization to just have an understanding of mental health and what it means and what happens for people, you'll start to, as I said, start to change things. So that would be my top tip, really, I think, for resources in organizations to have.
Lovely, thank you. And a quite pertinent point, I think, perhaps for you, Andrea, if you could take this one. What are some of the legal issues to consider in dealing with mental health in the workplace?
Okay, I think first and foremost, we touched on it very, very briefly earlier, but all employers have a duty of care, and that's to everybody. That means that they must do what they reasonably can to support employees' health, safety, their well-being. So this would include things like making sure the work environment is safe, protecting employees from discrimination, carrying out risk assessments if they're needed. And then on the topic of discrimination, here in the UK, I know a lot of the people that have dialed into the session today are based in the UK. Like a lot of countries, we have legislation that protects people. So here, there's something called the Equality Act, which protects disabled people from unfair treatment, and that extends to mental health. So the Act talks about mental impairment. So it protects people from unfair treatment, so protection from discrimination, from harassment, from bullying, from victimisation, and many mental health conditions would fall under that definition of a disability. Now certainly not all, but many would. So the definition looks at a condition that is prolonged and something that impacts, you know, daily lives, which is the case for a lot of mental health conditions. And so it means that people need to be treated fairly in terms of what happens at work, you know, treated fairly, treated with respect, have equality of opportunity, you know, whether that's in terms of, you know, promotions or roles, or and it also extends to the interview process as well. So it's not just for employees, but that protection against discrimination also extends to when you're looking for a job. And the other thing that employers have to do is that they have to make, if there is a disability, they have to make reasonable adjustments to the working environment. So in the context of mental health, that might mean things like, so the key things are around having a duty of care, being aware of protections under the Equality Act and any sort of reasonable adjustments that you might need to make. But obviously today's session was is focusing a lot more broadly than things that are required as a minimum under legislation.
Okay. Thank you very much, Andrea. I think we've got time for a short answer, if you wouldn't mind, Lauren, to this question for you, and just really a summary of what, in your view, is involved in mental health training.
Yeah, sure. So, I mean, in terms of what we do at Well Minds at Work, so there's lots involved in you know, mental health training. I saw in the chat there some people are training to be a mental health first aider, which is fantastic. But in terms of what we do and what's really important is tailoring, first of all, the content to the environment that we're working with, the clients that we're working with. So making sure it's relevant, because if we have if we haven't got the issues right in terms of what we're trying to talk about, or the message that needs to be, needs to be received, then it's not necessarily going to land. So it's really about, first of all, making sure that the content is tailored. But in terms of what's involved in the sessions that we run, we have two popular sessions. The first one, as Amy sort of alluded to, is mental health awareness training. So in that, it's really about increasing people's awareness of mental health in the workplace, what it looks like, different conditions, stress, how to spot stress, how you can manage it better yourself, and how you become, how best to approach if somebody does talk to you about it, what you can do, and how to be a supportive team member. The other one that we run is mental health training for managers, and that's really about building skill and confidence, and we write a case study specifically for the clients that we're working with to make it relevant. But it's very much around what signs do you spot, how to have that conversation, how to start it, what kind of questions did you ask, linked to sort of your duty of care, and then we also have coaching elements in with that as well. So we offer, as part of those programs, one-to-one coaching, just to really help make it practical, because it can be quite a nerve-wracking experience for somebody. How much can I ask, how much can I say? So it's just making that trying to give people real practical information and practical guidance, as well as a toolkit for them to implement.
Lovely. Thank you very much to everybody today, and that's going to conclude our webinar for this afternoon. So it just really leaves me to again thank our speakers, Lauren, Amy and Andrea. As I said at the beginning, a further recording and content will be available on our website, morganmckinley.com, and please feel free to reach out to Well Minds at Work. Their contact information is on the screen now. And finally, I would just like to extend our thanks to you, the audience, for joining us this afternoon, and we wish you a very pleasant afternoon. Thanks very much. Bye-bye.
Thank you. Thanks very much.